Okay, so
So,
good evening, everyone. I, Namrata Padkiri, shall be the host for today's session. So, I welcome you all to another session of Enajury with Community Health. And before starting, I would like to brief you all a bit about Enajury. So, Enajury, in simple words, literally means the bond of love. Milindatta is the founder of Enajury, and it is his love for his native land that brought him back from the USA to Assam in order to start this non-profitable organization that engages and promotes various initiatives such as striving for social change, loving leadership skills, and building entrepreneurship capacities among the people living in Northeast India. For a couple of months now, we have been interacting with speakers from different regions via virtual media on the topics that are very current and significant in today's generation. So moving forward, the topic of today's discussion will be breastfeeding and complementary feeding. And we have our honorable speaker between us today, and his name is Dr. Shaheen Rahman. He is an associate professor of community medicine at Nagaon Medical College. Beyond his academic achievements, he is a professional bodybuilder, having earned prestigious titles such as Mr. Assam 2025, Mr. Kamrup 2015, and third place in Mr. India 2017 in the Masters category. His passion for fitness extends beyond personal accomplishments, as he is also the owner of Dr. Shaheen's Fitness Center, a unisex gym dedicated to promoting health and wellness. Dr. Rahman blends his expertise in medicine and his commitment to fitness, inspiring many in both fields. So I welcome you, sir, to today's session. And now I would like to take you over the screen. Please, sir.
thank you, Namrata, for your introduction. And so, I would like to start my session, and my topic of discussion is breastfeeding and complementary feeding. So, as you all know, I think that what is breastfeeding, and breastfeeding, it is an optimal way to feed an infant. Infant is a child less than 1 year of age. So immediately after the birth or after the delivery of a baby, um, he or she should be put to breastfeeding within half an hour or 1 hour of birth, because breastfeeding is the first immunization in a child. And contains, because it contains all the anti-infective factors like immunoglobulin A, lactoferrin, lactoglobulin, and these helps in fighting different infections which the infants are very prone. And therefore, breastfeeding helps. It's a im- it's it helps. It improves the quality of life by providing unique nutritional, immunological, economic, ecological, psychological, and child spacing benefits. So, as I've already said, that the babies are most active for, even immediately after birth, within the first 30 to 60 minutes. So during this time only, the baby should be put to the mother's breast, so that it helps to get the first milk from the mother, which is called the colostrum. The colostrum is rich in protein content, and also it has got the anti-infective factors like immunoglobulins, lactoferrin, lactoglobulin, and um, and as I have said that uh, colostrum is the first immunization of the baby. So it also helps in developing a bond between the mother and the child when the breastfeeding starts, and it helps to maintain. So when the baby is put with allowed to sleep with the mother, and because of this bonding, which is also called kangaroo care, so it helps to there is skin to skin contact of the baby and the mother. It helps to keep the warmth of the child and avoid from hypothermia in infants. Then a baby should be should be breastfed exclusively. That is exclusive breastfeeding up to 6 months, because during this period of time, the child, if he is given any other food other than breast milk, like water also, so the child is prone to infections, because the infection can be born from the water, and the baby's gut system is not well developed. Okay, so these factors are important. That's why baby should be always exclusively breastfed till 6 months. So after 6 months, the energy requirement for the baby is more than only that the only breast milk can provide. So you have to gradually shift the baby's food from meal, that is baby's meal, from the breastfeeding to also the other food which is normally taken by the other members of the family, and it should be started gradually. uh, Say first 1 or 2 times per day, to 2 to 3 times, and and later, before just 1 year, that is in 12 months, 4 to 5 times per day. And this shifting of from breast milk to the normal food which the baby takes with the along with the other members of the family, it is called the complementary feeding. So, and that's why today's discussion is especially on child's nutrition, and I'm focusing on breastfeeding and and complementary feeding. So breastfeeding should be continued up to 2 years. So after exclusively breastfed till 6 months, the baby should be gradually given complementary feeding along with breastfeeding till uh, 2 years of age. Then other advantages that it provides in mother is that it gives lactational amenorrhea. Lactational amenorrhea helps in spacing the birth of the um, mother. So from the next pregnancy, that means she does not have to use any birth spacing methods. If the baby is exclusively breastfed, then that exclusively breastfeeding will help in lactational amenorrhea, and that is helps in the um, it's a natural contraception for the mother. So another important factor for the baby is it is rich in your unsaturated fatty acid, which is helps in an uh, development of the brain and the development of intelligence, that is intelligent quotient. So um, so babies who are exclusively breastfed, they have got high intelligent quotient, and those who are not exclusively breastfed. So another important advantage that can give to the in case of mother is prevents the risk of breast and ovarian cancer and anemia in mothers. So apart from the brain development, it has also it also gives better visual development and visual sharpness. Okay, and the breastfed babies are less prone to have asthma and other allergic disorders. Then, and it protects the child against several infections, including diarrhea, respiratory infections, and many chronic problems like hypertension, high blood pressure, diabetes, and heart disease in babies in the future. So, and because breast milk contains the right kind of protein, fats, lactose, vitamins, iron, minerals, water, enzymes in the amounts which is necessary for the baby. So iron in breast milk is better absorbed, and the breast milk contains more water soluble vitamins, that is vitamin A, C, E, and D. It contains lactoferrin that binds with iron and prevents the growth of harmful bacteria. And it is clean, it is free from bacteria, and it has also got some anti-infective factors, as already I have mentioned. It is ready to serve when the baby wants it, and there is no need for preparation, and it can be provided at the right temperature which is required for the baby. It is economical and free from contamination. And in mother, it reduces anemia due to reduction of postpartum bleeding and reduced blood loss because of delayed menstruation. Obesity is less common among breastfeeding mothers as it helps the mother to regain her normal figure. It exclusively breastfeeding also has promotes early uterine involution due to oxytocin release. And mothers who exclusively breastfeed their babies, they are better adjusted with their babies as far as rearing and behavioral adjustment are concerned. So apart from the benefits to the baby and the mother, breastfeeding also has benefits to the society. So breastfeeding lowers the healthcare cost by reducing the illness among the children, and so reduces the financial strain on the family. Fewer sick children because of breastfeeding allows mothers to attend to work more efficiently, thus provides less costly to employers. So what are the advantages? I just uh, describe in brief. One is it has got the perfect nutrients. It is easily digested. It is effectively used. It protects against infections, and it helps to maintain the bond between the mother and the child. It delays another pregnancy, and it protects the mother's health. And the cost is less than artificial feeding. So artificial feeding is dangerous, as you know. It is those artificial feeding means any feeding other than breast milk, that is suppose non-human milk, maybe infant formula, maybe animal milk, maybe cow's milk, buffalo or goat or camel milk, then condensed milk. Okay, it is not suitable for feeding infants because they are if they are more, the infants will be more prone to diarrhea and respiratory infection, persistent diarrhea, then malnutrition, vitamin A deficiency, and their mortality rate will be higher in such infants who are artificially fed other than breast milk. They are more prone to allergy and milk intolerance, increased risk of some chronic diseases, as I've already said, heart disease, diabetes. Then overweight and babies who are artificially fed, later they suffer from weight gain, increased weight gain, and lowers the scores on intelligence test. So babies on animal milk have higher incidence of indigestion because of delayed gastric emptying and likely to develop some gastrointestinal infections as well in apart from respiratory infections. So that's why breast milk is much better in relation to cow's milk because it has anti-infective substances like antibodies like immunoglobulin A, then leukocytes, lactoferrin, and bifidus factor. So it is less rich in protein compared to cow's milk because cow's milk is rich in protein. It leads to indigestion in infants. So again, the fat the fat contained in breast milk is rich in unsaturated fatty acid, as I have already mentioned before, which helps in the brain development of the infant. But in case of cow's milk, it is more rich in saturated fat other than unsaturated fat. Okay. Then the salt content, the sodium chloride and potassium content is more in cow's milk than breast milk. So those are who are given cow's milk, they're more likely to have hypernatremia and convulsions. And it also contains too much of calcium compared to cow's milk, and it can lead to tetany, muscle twitching, and spasm of muscles in infants. So then the water content in breast milk is enough to quench the thirst in infants. But it is, whereas in case of cow's milk, the water content is not enough. So you have to dilute the cow's milk, or you have to give extra water. And these extra water, these are a source of infections for the infants. Then the iron which is present in breast milk is easily digested. But the iron content in cow's milk is not easily digested. So this is the difference between the cow's milk and your human breast milk. So colostrum, which is the first milk which pregnant after the delivery of the baby. So it is a special milk for the baby, which is thick, sticky, and light yellowish in color. And it is secreted in small amounts, which is required for a newborn infant. It is in 30 to 90 ml per day. And it is sufficient to meet the caloric needs of a newborn infant in the first few days of life. So colostrum contains large quantities of protective substances and growth factors and has more proteins, minerals, vitamin A, K, and vitamin K than mature milk. So this vitamin A, it prevents the eye diseases, and vitamin K prevents the bleeding in the newborn. So other than from the colostrum, there is a transition milk. When from before coming to mature milk, there is a stage called transition milk. So during the 2 weeks following the colostrum stage, the milk increases in quantity and changes in appearance and composition as per the baby's needs. The protein content decrease while the fat and the sugar content increases. So then then we start the mature milk. The mature milk is thinner and watery, but contain all the nutrients which is necessary for optimal physical and mental development of the baby. And mature milk changes even during the length of a single day to suit exactly the needs of a baby. So it has got two parts in mature milk. One is fore milk and hind milk. The first part of the mature milk is called the fore milk, which is watery and bluish in color, and it has got low level of fat, but it is high in lactose, sugar, proteins, vitamins, minerals, and water. it satisfies the baby's thirst and is produced in large amounts than the hind milk. Whereas in hind milk will comes later in a feed. So it is rich in fat, and this extra fat makes it looks whiter than the foremilk. It satisfies the baby's hunger and supplies much of the energy of the breastfed infant. Uh, that is, it. So therefore, to get a complete meal, the baby should get both the foremilk as well as the hind milk. There is another term called the preterm milk. Now, the milk which is produced by a woman who has delivered prematurely is called the preterm milk. Now, this milk has got more protein, minerals, immunoglobulins, lactoferrin than mature milk, and making it more suited for the needs of the preterm baby. And preterm milk is essential and best suited for the survival and the growth of a preterm baby. Term milk, the milk produced by a woman who has full term delivery, is called the term milk. So these are the different types of milk, as I have already said. So next is the how the breast milk production occurs. Now the milk is produced due to the secretion of prolactin hormone in the anterior pituitary gland of the hypothalamus. So, this prolactin helps in the milk production in the milk secreting cells, which is present in the breast. Okay, and the muscle cells, which is present between the milk secreting cells. So, the oxytocin, which is released from the posterior pituitary, help in ejection of this milk to the lactiferous sinuses where the milk is collected, and from these sinuses it is transferred to the lactiferous ducts. From these ducts it goes out to the baby's mouth. So there are different reflexes. One is your prolactin reflex or milk secretion reflex. So prolactin is secreted especially at night time. So therefore, night feeds are very essential for breastfeeding infant. And always breastfeeding should be given on demand, and there should be demand feeding. Okay, so it should not be schedule feeding. That means you have to give on this time, not like that. When the baby cries, when the baby needs the breast milk, then immediately the mother should give the infant the breast milk. It is called demand feeding. So, and breastfeeding should be specially practiced at night because the milk secretion is more due to prolactin release at night. And when the baby sucks the breast, that is, sucks the nipple and the areolar region, then there's a reflex which is called the suckling reflex. And this reflex helps in secretion of oxytocin from the posterior pituitary gland, which helps the squeezing the muscle cells of the breast tissues around the milk secreting cells. From this, the milk secreting cells, the milk flows to the lactiferous sinuses, and from the sinuses to the lactiferous ducts, it ultimately reaches the nipple and the baby's mouth. So there is two reflexes. One is rooting reflex and one is suckling reflex. Rooting reflex, when a baby is put to the breast, then the baby's mouth faces the nipple and the areola. So that is called the rooting reflex. And the sucking reflex, I've already mentioned it. Then next is then what is prelactal feeds? I'll just tell you in before starting with how to breastfeed the child. So prelactal feed is a feed of formula feed, actually cow's milk or glucose water given before the breastfeeding. Some sections of the community, they practice this prelactal feeding, which is very harmful to the baby because it leads to several infections, including diarrhea, respiratory infections. So prelactal feeds such as honey, water, artificial milk, or infant milk formula inhibit the lactation process. So, the baby may not want to suckle the breast because the artificial feeding stop his feeding hungry or thirst. He does not get the colostrum. Diarrhea and other infections are more likely. Then allergic conditions are more likely if the baby has cow's milk very early. The bottle fed uh, bottle feeding, when the baby is bottle fed, there is nipple confusion. If he sucks from the bottle teeth, it makes the baby confused between a rubber teeth and a human breast. So again, for the mother also, breast milk takes longer time to come in because the baby does not get enough milk. Then mother suffers from breast engorgement, mastitis. Then mother has more difficulty in establishing breastfeeding. So these are the different disadvantages of prelactal feeding. Then position of the baby is very important for the proper breastfeeding. The baby should face the baby's face should face the breast. Okay, the head and the neck should be uh, straight. The baby's head and the neck and the body should be straight. Baby with his face facing the breast and his nose should be opposite the mother's nipple. The baby with his body close to mother's body, and mother should support the whole body by her hand. That is the back of the baby. So so then the mother should be explained how to breastfeed. Then for proper breastfeeding, there should be good attachment, which is there like there are certain points that should be noted. One, the baby's chin should be close to the breast. Baby's tongue is under the lactiferous sinuses and nipple against the palate. Baby's mouth should be wide open and lower lip is turned outside. Then more areola is visible above the baby's mouth, then below, and there should be no pain in the nipple area during breastfeeding. So these are the signs of good attachment. Then what are the signs of poor attachment? When a baby sucks only at the nipple, mouth is not wide open, okay, or much of the areola and the lactiferous sinuses are outside the mouth. Baby's tongue is also inside the mouth and does not cup over the breast tissue. Chin is facing away from the breast. So sucking in this position may cause pain to the mother in the nipple and the areola region. So these are the important points that should be noted. So what happens if the baby suckles in the incorrect position? So one I have already mentioned, there can be pain and damage to the nipple. There can lead to sore nipples, fissures. Then again, breast milk, if it is not removed effectively, it can lead to breast engorgement. And apparently, if poor milk supply will produce, the baby will be unsatisfied and wants to feed a lot. So baby will be ultimately will become frustrated and ultimately it will refuse to suckle the breast. Then breast, if it makes less milk, so it will ultimately lead to the failure of growth in the infant. So there will be loss of weight in the baby. So what are the problems which is faced during breastfeeding? So one is the flat, there can be flat nipple, there can be inverted nipple, Then there can be fullness and engorgement of the breast. Then there can be blocked duct. There can be mastitis and abscess. So sore nipples, cracked nipples. So these are the different problems that can be faced in while breastfeeding. So how will you say that the baby is getting enough breast milk? First of all, you have to see the adequate weight gain. Now, after 2 weeks of age, the baby gains 25 to 30 grams per day during the first 3 months of life. Then from 3 months to 6 months, the baby weight gain is 20 grams per day. Again, from 6 months to 9 months, it is 15 grams per day. And from 9 months to 12 months, the weight gain is 12 grams per day. So this is how the weight gain occurs. So the mother should notice the weight gain. And number two is passing the urine 6 times, minimum 6 times per day if the baby is exclusively breastfed. So so what are the possible signs that the baby is not getting enough breast milk? First of all, if the baby is not satisfied, if cries often, it wants frequent breastfeeding, it takes longer breastfeeding, it refuses to breastfeed, or it has got hard and dry and green stools, or infrequent small stools, or if the breast did not, suppose the mother complains that breast did not enlarge during pregnancy, or breast did not come in after delivery, and no milk comes out on expression. So these are the uh, factors. Now, what are the different factors when why the baby is getting enough, not getting enough breast milk? So there are some breastfeeding factors. Number one, if there is delayed start, as I told you, that immediately after birth, the baby should be put to the breast within 1 hour, preferably half an hour after delivery of the baby, before the delivery of the placenta. So when the baby is put to the breast, then there is oxytocin release from the posterior pituitary gland. It prevents the uterine bleeding, that is postpartum hemorrhage, and also expulsion of the placenta. Then another factor is that infrequent feeding, if it is present, or in no night feeding, or short or interrupted feeds are there. Schedule feeding, as I told you, the mother should practice demand feeding, not schedule feeding. Okay, so if there is schedule feeding, the baby will not get enough breast milk. Then if there is poor attachment, if the attachment is poor, or if there is bottle specifiers, complementary feeds is started earlier than 6 months, okay, then the baby may not get enough breast milk. Then there are some mother psychological factors like lack of confidence, worry, stress, dislike for breastfeeding, tiredness, or mother's physical conditions, like, for example, using contraceptive pill or diuretics, then pregnancy, severe malnutrition, alcohol, smoking, retained piece of placenta, if it is present, it is rare, but, or poor breast development, that is also rare, or babies, if the baby, suppose, is sick, if there is illness, okay, baby is not well, or if there is some physical abnormality of the breast, of the baby, for example, cleft palate or cleft lip, cleft lip and cleft palate. So these are the different conditions why the baby is not getting enough breast milk. Then there's another term called express breast milk. So expressing breast milk is need for a low birth weight babies or a sick baby, or to relieve engorgement, to relieve the blocked ducts and maintain the milk supply when the mother is ill, or relieve the leaking breast, or leave the milk for the baby when the mother goes out to work, for example, in case of working mothers. So, or feeding a baby while he learns to suck from the inverted nipples, or feeding a baby who has difficulty in coordination. So when how now when while expressing the breast milk, you should choose a cup or a glass or a jug or a jar with wide mouth and a cover. You have to wash the cup and this with soap and water, and pour boiling water into the cup and leave it for a few minutes, and boiling water will kill most of the germs. Okay, or and when ready to express, you have to pour the water out of the cup. The boiling water should be put out of the cup, and you have to uh, store the express base milk for in a refrigerator for 24 hours. And if it is kept at the room temperature, you can store it for 8 hours. And you have to feed the baby with a cup and spoon. So let us discuss now complementary feeding. So breastfeeding I have described in short. So as the time is running, so complementary feeding can be defined as any non-breast milk food or nutrition given to the young children in addition to breastfeeding. Breastfeeding alone is sufficient food for the first 6 months of life. Say 6 months of your age. Thereafter, complementary foods are required to ensure adequate growth and to prevent malnutrition and stunting. Okay, stunting of growth. That is stunting, which is very common in this age group of 6 months to 24 months, that is 2 years. So the 6 to 11 months period is a special vulnerable time because the infants are just learning to eat and must be fed soft foods frequently and patiently. Care must be taken to ensure that these foods complement rather than should not replace the breast milk. They should just complement the breast milk. That means in addition to breast milk, because the energy requirement is more after 6 months, you have to give this energy requirements from this complementary feeding. For older infants and toddlers, the breast milk continues to be an important source of energy and protein, vitamins A and vitamin C. Therefore, breastfeeding should be continued at least up to 2 years while receiving the complementary feeding. So, remember now how this there are different reflexes. For example, the rooting reflex and the sucking reflex and the swallowing reflex mechanism are present at birth as they facilitate the breastfeeding. So these are I've already described. By 6 months, an infant can voluntarily control the sucking and swallowing, and biting movement begins. By 7 months, the gag reflex that moves food from the mid position to the posterior third of the tongue and assists in feeding solids. By 8 months, munching reflex up and down mandibular movement becomes apparent. And this permits the consumption of solid food and lateral movement of the tongue, which also pushes the food to the molar teeth. Okay, for proper munching. By 9 to 12 months of age, the infant can use the lips to clean a spoon and use the tongue to leave the food between the teeth and chew the solid food. By 12 to 18 months, the full rotatory chewing movement starts, allowing disposal of fibrous foods such as meat, fruit, and vegetables. So this means after 6 months, a child eats soft and starchy food such as cereals, and by 9 months, the infants can be given chopped foods. So for the first 6 months, all the energy comes from breast milk. Between 6 to 12 months of age, complementary foods are introduced to fill the energy gap and also provides minerals including iron, zinc, vitamins, and but breast milk continues to provide a larger proportion of child's nutrition. So what is there are now complementary feeding should be start immediately after 6 months after exclusively breastfeeding. But if the complementary food is started earlier than 6 months, what are the different problems that can arise? One, it can lead to displacement of breast milk because breast milk is fully nutritious, and while other foods are nutritionally inferior to breast milk. Now, it leads to quantitative reduction of protective factors, which is available with breast milk, as I've already described. Now, early introduction of complementary feeding will lead to early cessation of breastfeeding and reduces the duration of breastfeeding. Then it reduces the availability of key nutrients such as zinc and iron. Then it hastens the return of maternal fertility. Then the risk of diarrheal diseases, which is a major cause of infant and young child mortality and morbidity, is increased. Now, what will happen if the complementary feeding should not be started late also? And what are the different problems that can arise if it is started late? Number one, insufficient intake of energy and protein will lead to poor growth in the baby. Insufficient intake of iron or may leads to anemia. Then insufficient of other nutrients can lead to malnutrition. Then different types of complementary food can be pulses, lentils, beans and peas, meat, chicken, fish, milk and milk products, then vegetables and fruits, oils and fats, and sugars. The oil, fats, and sugar increase the dietary energy levels. Milk products and other animal foods improve the quality of protein in the diet. And milk also provides calcium. Meat, then chicken, fish are important source of iron. Vegetables and fruits are rich in vitamins and minerals. So complementary foods should be started from 6 to 9 months. So 6 to 9 months, you have to give the home-based foods, that is family pot feeding, and gradually increase the amount of food over 3 to 6 weeks. Increase 5 to 60 grams to half a cup or one banana, and feed 2 to 3 times a day as the baby have small stomachs and only small amounts at one time. From 9 to 12 months, you have to give almost anything that is cooked at home, softened and without spices, chopped and pounded food introduced, and gradually increase the quantity starting from three feeding to 5 to 6 times per day. The vegetables and seasonal fruits can be added, and fish and minced meat can be given in non-veg. And plus, you have to continue the breastfeeding. In 12 to 18 months, besides breastfeeding, the quality of food is very important, and give roughly half the amount that the mother eats, and give about 50 grams of green leafy vegetable to avoid anemia and vitamin A deficiency. But you have to continue breastfeeding, and you have to continue feeding also during illness. There are certain acts also I'll just describe in short, that infant milk substitute, feeding bottles, infant foods, regulation of production, supply, distribution of Act 1992. It is a law to protect and promote breastfeeding. And the objectives are it prohibit the promotion of infant foods, infant milk substitutes, and feeding bottles. It educate the pregnant mother and mothers of infants about breastfeeding, ensure the proper use of infant milk substitutes and infant foods, and define the role and responsibilities of healthcare institutions and health workers to ensure the proper use of infant milk substitutes, feeding bottles, and infant foods. We follow the breastfeeding week from 1st August to 7th August every year. And this year also we have already celebrated the World Breastfeeding Week. And the theme of for this week was closing the gap and breastfeeding support for all. World Breastfeeding Week is held in the first week of every August every year, and is supported by the World Health Organization, UNICEF, and many ministries of health and civil society partners. So as the campaign, the theme that is for 2024 is closing the gap and breastfeeding support for all. The campaign will celebrate breastfeeding moms in all their diversity throughout their breastfeeding journeys, while showcasing the ways families, societies, communities, and health workers can have the back of every breastfeeding mom. So this is in short I have described about breastfeeding and complementary feeding. I hope I have not crossed the time.
Uh, Sure, sir. Sir, first of all, I would like to thank you for briefing us so much information about breastfeeding and complementary feeding. So, sir,
Thank
as
you.
you know, we are already running out of time. I will quickly present a few questions for you. So, sir, my first question will be, what are the advantages of breastfeeding for the baby, mother, and society?
Uh, it is an important, that is very important questions you have put already. So one is benefits to the baby is that I have already told you that breastfeeding is rich in immunoglobulin A, and plus it is rich in unsaturated fatty acid, which is help in the brain development. So breastfed infants have got higher intelligence quotient. Again, it enhances the brain development and better visual development and visual sharpness, leading to reading and learning readiness. It enhances the bonding, emotional bond between the child and the mother. Okay, and provides the warmth, love, and affection because it is more than just a food for the infants. And breastfeed child, they are more likely to have asthma and other allergic disorders. Now, breastfeeding protects the child against several infections, including diarrhea, respiratory infections, and many chronic problems like hypertension, high blood pressure, diabetes, heart disease. Okay, so because it contains the right kind of proteins, fats, lactose, vitamins, iron, minerals, enzymes, which is in amounts which is necessary for the baby. And benefit to the mother is that it reduces anemia due to reduction in the postpartum bleeding, as I have already said, and reduce the blood loss because of delayed menstruation. And obesity is less common among the breastfeed mothers, and it has got protective effect against breast and ovarian cancer. And exclusive breastfeeding has a contraceptive effect. It leads to lactational amenorrhea during the first 6 months of postpartum, that is after delivery of the child. Then mothers who are exclusively breastfed their babies are better adjusted with their babies as rearing and behavioral adjustments are concerned. Now, what are the benefits to this society? The breastfeeding lowers the healthcare cost by reducing the illness among the children and so reduces the financial strain on the family. Fewer sick children because of breastfeeding allows the mother to attend to work more effectively and thus proves less costly to the employers. So this is how the breastfeeding has got advantages not only to the baby but to the mother and the society as well.
So, sir, can a breastfeeding mother continue if she becomes pregnant again? Like,
Pardon?
should the breastfeeding be continued for a mother who is pregnant again? Suppose she is already feeding her child, her newborn child, and then again she gets pregnant. So
Yes,
in that case,
I have already told you that when a mother pregnancy occurs in a mother who is breastfeeding her child, then the breast milk amount will decrease.
Mhm.
You understand? The breast milk that is the physiological process which helps in milk production, okay, that will decrease because of pregnancy. So, and the baby will be having will not get the right amount of breast milk that it is required because the baby should be exclusively breastfed till your 6 months. So the baby has to be put to artificial feeding like infant milk formula, all those things. And I always told you there are disadvantages of artificial feeding. baby will having more prone to diarrhea, respiratory infections, then malnutrition, vitamin A deficiency, then more allergic manifestation, milk intolerance, then increased risk of some chronic diseases, overweight. Okay, and his intelligence quotient will also decrease because breast milk has helps in the brain development. Human breast milk, it is not present in the any infant milk. It is not present in the artificial feeding. Artificial feeding means maybe cow's milk, maybe infant milk formula. Okay, bottle feeding. So if the baby, if the suppose if the mother is having less breast milk, then he will be given bottle feeding. So bottle feeding the that it is made of plastic, no? So there will be confusion. So when it is put to the baby's mouth, so he will have nipple confusion. So when the baby is put back to the breast, he will forget to suck. He don't know to suck, and there will be poor attachment. And because of poor attachment, the milk supply for the baby will be less, and therefore there will be growth failure in the infant.
So, sir, is it possible that many of the psychological
So
disorders are related?
that's why I've already discussed that a mother cannot have pregnancy if she is exclusively breastfed. If she is not exclusively breastfeeding, then she will have pregnancy. Even if she stays with her husband at night, so she will have that contraceptive action due to exclusive breastfeeding. So that is why I've already discussed this thing. She will be having lactational amenorrhea, which is nothing but it helps in prevention of pregnancy. Is it clear, no?
Sir, so I was saying that since the
But
child is detached from the
if the child, yes, tell me.
sir, since the child is now detached in this case from the mother's milk, since
Mhm.
she has got pregnant again. So,
Yeah.
sir, is it possible that the child will born with some more psychological disorders in as he
Yes,
grows up?
yes. He'll have some problem. He will face
Okay,
problems.
sir.
I told you.
So
As I
you
told
were
you that
saying something.
as I've already told you, what I was saying, yes, I was saying that those mothers who are not able to breastfeed, they can give express breast milk also to prevent from breast engorgement and mastitis, or in the long run, in it can lead to your breast abscess. Okay, so to prevent this, they can give express breast milk. The breast milk has to be squeezed out. Breast milk has to be squeezed out from the breast in a cup. I told you how it is prepared. I've
Yes,
already
sir.
discussed this. So you have to put it in the. You have to cover it up, and you in room temperature for maximum for 8 hours. And you can, if you put it in the fridge, you can put it in for 24 hours. But after 24 hours, you cannot use it.
So then again, could you brief us about what are the dangers of prelactal feeds?
Pre-lactal feeds. Dangers is that for the baby, he may not be able to, because he is not breastfed, right? He's
Mm.
given some other food other than breast milk. So he may not want to suckle the breast because the artificial feed stop his feeding hungry or thirsty. He's already his hunger and thirst has been completed by the pre-rectal feeding, like cow's milk, glucose water, honey, artificial milk or infant
Pre,
milk formula.
the
Then the
prelactal means something which is not
lactal,
mother's milk, right?
which is given other than breast milk, if you give other
Mm-hmm.
other field pre-lactal before
Okay,
giving
sir.
breastfeeding, you're not giving breastfeeding. You're not putting to the breast. Artificial feeding means in addition to breast milk, you're giving other feeding. That is okay.
Mm-hmm.
That is artificial feeding. But pre-lactal means you're not putting the baby to the breast only. Before
Okay,
that,
sir.
Before that, you are giving some other food. You're not giving breast milk only. So he will not
Mhm.
get the first milk of the mother, as I've told you. It's called the colostrum, which is very important for the baby, for his brain development, for his gut development, respiratory tract development, intelligent quotient. Okay, and it is called the first immunization of the baby. Then it will lead to diarrhea, it will lead to infections, it will lead to allergic conditions. Okay, if the baby is getting cow's milk, I've already discussed the difference between cow's milk and human milk, right? Then
Mhm.
bottle again, if the baby is put to bottle, there'll be nipple confusion in the baby, so he'll not be able to suckle the breast. The reflexes will be lost, the rooting reflex, the sucking reflex, all these reflex, the swallowing reflex, all these things will be lost. Okay, then for the mother, it will take her longer time, okay, to come in, to bring the milk in the breast, because the baby does not get enough, cannot suckle enough, because he's not hungry. No, his hunger and thirst has been cut down by the prelactal feeding,
Pre-lecture.
and there's breast engorgement. That's why, because milk will be present inside the breast. So when there's milk is present, it will be engorgement of those ducts, right? And lactiferous sinuses. It is breast engorgement. Then if it is if the it for if the milk stays there for a longer period of time, there will be bacterial growth, infection. It lead to mastitis. Understand? And for longer period, if it is there from mastitis, it will lead to abscess. Okay, because the baby does not remove the milk, right, from the breast, and the mother has more difficulty in establishing the breastfeeding and more likely to stop then even one or two prelactal feeds may cause breastfeeding failure. So you should not give prelactal feeding at all.
Sir, as you have mentioned that one primary reason for the signs when a baby should be fed with breast milk. So, sir, as you have mentioned that if the baby cries and demands for milk, then this could be a sign for the mother to feed that particular baby with
Yes,
breast milk,
yes,
right? So, sir,
yes.
apart from this particular
It is
sign, what
called
are the other
demand
signs that
feeding.
can help a mother to know if her baby is receiving adequate milk or not?
So baby is receiving adequate milk or not, I have already described. One is you have
Mm.
to, the mother should assess the weight gain of the baby, and she should notice the baby's, his or her passing urine, if minimum 6 times per day, 6 to 8 times. Okay, urine should be passed. She should notice. That means the baby is getting enough breast milk.
Okay, sir. So my next question is, are there any common myths or misconceptions about complementary feeding that the mothers could have?
Misconceptions.
Yes, sir.
Misconception means, see, complementary feeding should be, that means shifting from the breast milk to the usual food taken by the other members of the family in small amounts, small and in frequent amounts, because baby's stomach is not big. Okay, so you've given small amount but frequent amounts. Okay, to meet the energy requirement for the baby, which is not sufficiently supplied by the breast milk alone. You understand?
Well, like
So,
I personally have seen many mothers feeding their
hmm,
child even after they have grown like 2 years or 3 years. So in that case, like,
there's
is
no
it good?
problem. There's no problem.
Okay,
Actually,
sir.
actually up to a limit, I have said that 2 years,
Yes,
maximum till
sir.
2 years. Even after if 2 years also, if a baby, if the mother is feeding a child, then breastfeeding continues, it is not a problem. But apart
Okay.
from breast milk, he should take other food,
Mm-hmm.
energy rich foods. Okay. And as I have told you, You can mix oil with rice or lentils. You can add vegetable, fruits, okay, uh, legumes, peas, okay. Then we can also use milk and milk products like curd you can add, no, like
Mhm.
that.
So,
It should be
this will be
locally
my last
available.
question.
It should be locally, the complementary food should be locally available, and it is used by the other members of the family.
Okay, sir.
So commercially
So,
available complementary feeds are again not good for the baby. Like Cerelac,
mm-hmm.
okay, because it doesn't contains the right nutrition which is required for the baby.
Sir, this will be my last question for the session. Sir, how can caregivers or mothers ensure proper hygiene during complementary feeding? What is your suggestion, sir?
First is that they should have, before touching the child, they should, proper hand washing is important. Okay, with soap and water, running water. Then after that, the contain then uh, if the baby is putting to breast milk, you can clean the breast, with a clean cloth, or you can also use some warm liquid water soaked in the cloth, okay, to stimulate the breast, okay. Or you can, the health worker, the lady, the Anganwadi worker or the nurse, okay, can pat the back of the mother,
Mhm.
okay, and give ask her to be comfortable and relaxed, should not be tensed. If she is tense, the milk secretion will be less. So she should be relaxed. It should be in a quiet environment, okay, and she should hold the baby's breast, baby's back by the forearm, okay, support the back, and the baby's face should, and the anterior portion, that is, of the baby, should face the mother, and his nose, the baby's nose, should touch the nipple, okay. And while breastfeeding, as I told you, there should be good attachment means the lower lip will be e- everted, okay, and most of the areolar part will be inside the mouth, okay. And it should, the nipple should touch the hard palate and soft palate of the baby,
Mhm.
okay. Then and the areolar part should not be visible, and it should be inside the baby's mouth, and chin should touch the breast, the chin of the
Mhm.
baby should touch the breast. So this is the way how the baby should be hold, and there should be good attachment of the baby. So the mother, so the health worker, or whoever is helping the mother, should be explained the proper positioning, proper attachment is necessary for proper breastfeeding. And hygiene should be, proper hygiene should be maintained, as you should wash the hands before breastfeeding. And if the baby is if the mother is working, then before preparation of express breast milk, she should, before squeezing the milk from the breast, she should hand wash her properly, clean her breast, okay, properly, with water and warm water, and one clean cloth, okay. And they should squeeze the breast, and use a clean cup, or I told you, any container with a lid, okay. You put some, you should be wash with soap and water, and then you can put some boiling water for proper sterilization, okay.
Mhm.
You to remove the water after that, and they give the mother's breast.
Breast
You to
milk.
take out express the milk, and you can store it, or you can feed the baby with cup and spoon. So that is
Okay.
my.
So, sir, this will be the questions from my side. So, sir, do you want to add anything from your side about the session?
Uh, I
Like,
have
how was
just,
your experience today?
well, today is my first experience, and first of all, my this Zoom was not working. I was got up tensed, so I don't know whether I'll start the session or not,
It's my
because
fault also that I could not like tell
you
you beforehand about the Zoom thing and
yeah
all.
you I have a laptop, but I use it in the because I take classes in Nagaon Medical College. All my slides are there in the my laptop, and I don't. It's difficult to carry the laptop daily up and down.
Mm-hmm.
So I keep it in my home at Nagaon. So there I have taken a rented house, so I kept it there. So I thought that I never thought that of the laptop. But after
Mm-hmm.
reaching my place, I just remember, oh, I have forgotten the laptop and what to do now. There, how will I do the presentation that I have? I was
Sir, so
really
extremely sorry, and I want to thank you as well for bearing with us in this condition.
welcome, welcome.
So, sir, thank you again, and we are honored. On behalf of Jury, I would like to thank you again for joining us today as our guest speaker. We hope
Yeah,
for another collaboration with you in the coming future.
definitely, definitely. I'll do that. Thank you so much.
Sir, thank you so much for joining today. Thank you.
Welcome.